What's going on, everybody? Happy Thursday out there in ADOM Nation. I'm your host, John Stamper, and excited to be here with you guys for another featured company. I share this every time. This is always great to have so many of these great companies out there that are helping dental practices, office managers, and more importantly, services that are relevant to what you do on a daily basis. And so very excited today to have Jake Corleone. I love that last name. Super cool. And Alistair Canal. So we've got Jake and Alistair with us today from Capital Collection Management. How you doing, guys?
Fantastic. Great. How are you doing?
Doing good, doing good. And so we're going to talk about something today that is near and dear to every office manager's heart, especially as we get towards the end of the year, which is not only collections, right, AR, but I think what's cool about how you guys are going to position it is that there is a way to do this the right way, right? Especially when it comes to a dental practice. You want to make sure that you get payment for the services, but in the same time, you want to make sure that you maintain that relationship. I know that's something that you guys do really, really well. So Alistair, before we get into some questions that we were going over, we'd love to have you share with everybody just a little bit about CCM and a little bit about your story.
I'd love to do that. Thanks, John. I appreciate it. So when we talk about CCM, if somebody asks me, who is CCM, right? Simply put, it's a collections company that gets it, right? It's been at this since 2013. CCM has been partnering with organizations in the healthcare space, really simply put, helping protect their brand and helping them improve the overall cash flow. I would say through efficient strategies, efficient solutions, and just a mindset on how to approach the business of collections, right? Because it is an element of every practitioner and every office manager's task to make sure that that's run smoothly. So simply stated, I would say we help dental offices rethink, reimagine, and recover and better manage their AR and their portfolios they have right now. So we've had great success, and we're delighted to be on this program with you, John.
Awesome. Well, again, thanks for coming on, guys. All right, Jake. So when we talk about collections and we talk about strategy, you guys certainly have some experience doing this. So I'd love to kind of jump right in and have you talk about what are some of the keys to a good collection strategy when it comes to dental practice?
Yes, it's a great question, and one that we get asked a lot. And really, it kind of breaking it down into kind of 5 areas to take a look at and focus on. One, you want to have a very well documented billing and collections policy and procedure, and that's you have to look at that not only on the patient side but also on your insurance side. You also need to make sure that you have an effective and easy to use and technology centric practice management system. You also have to train your staff, make sure you have a very robust training around the collections and receivable side. Reporting and analytics is obviously paramount when you're looking at your accounts receivable, being able to understand the numbers, being able to dive into those and provide reporting back to the ownership and to the doctors, as well as really having a strong collection agency partner that's able to come in and help support you and really be that expert in collections to be able to help guide the practice.
Perfect. All right. So once the practice,
if I can,
is
talk a little bit about how this has impacted practitioners in the pandemic, right? I think that's a pretty big thing that's come about. Kind of get into just a little nuance on that if we could.
Yeah, absolutely. Yeah, I think with everything that everybody's been going through, love to have you talk a little bit about how the pandemic has certainly impacted collections.
Sure. Yeah. So the pandemic is obviously had widespread issues and ripples around the patients as well as the practice. So really having we're on our side, we're ramping up, the empathy. We're training our staff on what's happening in key areas because we're a national agency. So when we look at, servicing providers and clients across the entire U.S., we're constantly ingesting information, what's happening, how people are being affected, to be able to let our team know that those key pieces of information, which again, the practices should be doing within their scope as well, because that knowledge and that information allows you to create effective messaging strategies, to create effective outreach strategies, and and really, having a strong technology base to support that function too is super important, because without the technology that we have specifically within our organization that allowed us to pivot and work completely remotely with our entire staff in a secure fashion within one day of this pandemic hitting and being forced to work remotely. Without having that strong technology base, we wouldn't be able to service our clients in the manner that we are able to. So I can't stress enough having a tech-enabled platform to work out of. On the practitioner side, it is very important.
Yeah, and Jake, I wanted to. I was curious. What's great about our audience and the office managers here, especially for these featured company live casts, is providing them with a couple nuggets, a couple things that they can literally implement in their practice tomorrow, next week, or what have you. So when you look at a collection strategy, can you share just maybe a couple of things that a practice can do fairly quickly to improve their collections process?
Yeah. So really. A couple of things right out of the gate is, looking at, kind of taking a step back and evaluating your process, looking at it from beginning to end. Where are the holes? Where are things bogging down? Where's the rub, essentially? And then narrowing in on that to try to address those situations. I think that's a very good first exercise, because that's going to, kind of shine a little bit of a light on some of the area that needs to be improved. The second part is to dive into the numbers. Collections and accounts receivable, it's really all about, it's about understanding the numbers. So if you're looking at your practice and kind of asking yourself, all right, well, do I understand these numbers as the dental office manager? If that falls under your purview, which I'm sure it does, do you have a good understanding of those numbers? Are those numbers widely available to you? And do you look at them often? Because with any type of, numbers-based thing, if you're not focusing on those numbers and understanding them and diving in, you're really not able to really understand what impacts, would be a positive or a negative to your strategy.
Absolutely. And Alistair, I know you mentioned, 2013. I mean, this is something that you guys have been doing, especially in the healthcare field. Can you talk a little bit about some of the approaches that you guys take that's a little bit different than maybe some other companies position themselves from a collections company perspective?
Yeah, no doubt. So, I think when we talk about what should be expected, right, and what does success look like? For us, we've built our business on the premise that, you have to talk human to individuals who are in that situation, right? They've got some debt, they've got issues, they've got scenarios that have come into their lives and perhaps of their own doing, or perhaps just situational, right? Like we talked about the pandemic, it's impacted so much out there that it's a situational, scenario for them. So for us at CCM, when we work with our clients, right? So that would be a dental office, would be our client. We try to make sure we understand their messaging and their mindset and how they want to communicate this messaging to their patients. So for us, it's that people first approach, right? That talk human, where it's not just a task to try to really hard press somebody to pay what they owe, but it's more of a situation of understanding, being empathetic, and sort of walking a step or two in their shoes to try to get an idea of where are they and how can we help paint that picture of success for them as the debtor, consumer, patient in this case, to really have that success happen for them to get financially solid with that practitioner who provided that great service. So as the office manager, which again, CCM knows very well, as one of our largest clients, Bankers Healthcare Group, deals only with the healthcare providers in many facets. So we've got a lot of expertise in that space and really try to understand what they go through and have that empathetic approach to the client and teach them and work with them to have that empathetic approach through us as a first or third party to get that money in the door for them. So I think it's that people first approach, right? So people over profits, as we say, relationships over revenue is really how we try to think about it as an agency. And when we do that, good things happen. Trust is built, relationships are built, bridges are built where people start to call us back. They start to trust us. They start to realize we're trying to help them. And when you have that approach, it makes a huge difference. And office managers have a big task, right? They're the glue and the machine that keeps that practice going. And in my experience, they're instrumental. And to have a plan and a partner that can help them succeed and continue to bring that cash flow in, that's paramount.
Yeah, and you touched on a little bit, Alistair, what would you say to a dental practice? And I love the philosophy that you guys are coming at this with, right? Because you guys obviously understand the importance of the relationships that they built with the patients and, how this whole process works. It's a very sensitive process. But what would you say to a dental practice, as you guys have done so many times, where, they're having to hand things off to, like, they were managing this process before, they were handling it maybe really, really close to their chest. Now they're going to bring somebody else in to manage that and to help them through that process. How do you guys like to approach that? What do you like to say to help them feel comfortable?
Yeah, it's a great question. So people, it's their business, right? So when what we always try to do is be empathetic to what they might be feeling as that client of ours who's looking at unleashing, a task that they were doing that they can control to us. It's their brand, right? So a practitioner spent many years in school to hang that shingle up to say, I want to provide really good, oral health care. And somebody else coming in to talk to those patients, there's a big kind of mindset internally for them that says, are they going to do it the right way? Are they going to manage our brand? Are they going to protect us the right way we want to be protected? So what I would say is be open-minded and work with a group that gets it. Or like I said in the beginning, that CCM really gets it. So you have to have that trust in the partnership that you're going to build, and you have to have the mindset of, as I always say, forget everything you know about agencies, right? Because people have their perceptions of what that means to bring on an agency, and we like to say, forget everything you know about it. Talk to us, tell us your situation, and let us explain to you what we feel we can do for you to help and collaborate with you to get success and to get these patients to be responsive and to get that, again, ever so important cash flow back into the door for that practitioner. That's their lifeline, right? It's their lifeblood. Yep. So it's really important. So I would say be non-myopic, kind of be open-minded to it, and look at the greater good for the practice, right? So that the practitioner, he or she didn't go to school to be a collector. And quite candidly, the office manager didn't as well, right? So when you look at that semi-cumbersome and perhaps at times uncomfortable task of reaching out to the customer and the patient in this case, to say, you owe us some money. I know that we know you real well. We know your family. We know your kids. We got to get this money in-house. It can be a bit challenging and it can be a bit cumbersome. So they want to make sure that's managed well, right? So it helps to bring somebody in to do that, to kind of take that burden off of you and to kind of separate that task and let somebody who knows how to handle that with your guidance and that understanding of what you're looking for. So that's what I would say, is kind of be open-minded to it and look for the greater good of the practice. And if it's a person or a group or an agency you feel comfortable with representing your brand, you're likely going to have success, whether it's us or someone else.
Yeah, I love that. So I think you've got the philosophy side, which you guys talked about, which is super important to CCM and what you guys believe in. Jake, you touched on it earlier at the beginning, how some of these newer technologies has really made the collections process a lot easier, right? For a lot of these things. So I'd love to have you touch on that a little bit, of some of the different technologies in the collection process and maybe some people might not know about, and then how you guys go about it.
Yeah. So when we look at technology, technology plays such a huge role in our modern society. Everybody's got a cell phone, everybody's on that. They've got iPads. There's apps for pretty much everything, and we're really, everybody's starting to embrace it. It doesn't matter your age group. So, so when we're looking at that, we need to utilize updated technology in our collections function. So often we hear, practices and different clients of ours that are relying on, different color notices to help drive money back into their practice. And honestly, a collection letter at this point is pretty inefficient if that's what you're really relying on. And changing the color doesn't do much to it. So kind of going back to the practice management system, you want to have a system that's, that gives you the ability to utilize an omni-channel communication process. So you want to be able to have a web portal where patients can come and look at their bills and self-service that debt, pay that, a really hands-off type of thing. You want to be able to communicate with your patients via SMS, email, maybe have an IVR so that somebody can come in and just call a number, not have to talk to anybody, that's open 24/7, 365, and make those payments. You want to make it easy for that patient as well as easy for yourself. And then, on top of that too, you want, with that system and with that technology, technology is done, it continues to do amazing things. And one of those amazing things is process automation. So there's a lot of, within our system that we use internally, we automate a lot of the administrative functions so that our staff isn't bogged down by doing, whether it's sending a notice or whether it's initiating an email. All of that stuff is done kind of in the background by the system. So, it really allows you to do so much more with so many less people. And we think that's very important, not only on, when you're looking at the practice, but really when you're looking at following a detailed process, because that process automation in that system makes sure that no steps are missed. So when you're looking at a complex omni-channel strategy, if you can automate most of those through your system, that's a home run. So then that person who's making calls, maybe sitting at the front desk, also handling new patients coming in and trying to make some outreach in the meantime, that can, if you're able to automate, the more you can automate, the better. I'll say with that, and that's what a great system and a great technology allows you to do. On top of that, you really want to make sure, again, kind of going back to that reporting and analytics, that you're able to pull robust reports, create dashboards, really keep those AR numbers front of mind to the practice. Because again, if those AR numbers go uncollected, that's, like Alistair alluded to earlier, that's the lifeblood of the practice, that money coming back in for those services provided.
Yeah, I love that. And Alistair, you mentioned earlier a little bit about the pandemic. I'm curious, with a lot of the practices that you guys work with, especially with this compassionate focus that you guys have towards this sensitive aspect of a dental practice. Have you guys seen, or have you heard from the practices that you work with, that in 2020, like have patients been more connected to their, like, has there been like I'm trying to think of the best way to say this, but like a resounding respect for the way that practices are handling asking for money in what are, tough times for a lot of people, quite frankly, financially. What have you guys seen? Like, what have you heard from practices in regards to how the whole collections relationship, which has always been up and down over the years with any business really, but what have you guys seen this year in particular?
Yeah, I think it's a really good point, right? So we always tend to kind of focus on the patient or the consumer in times like this, and I commend the practitioners and the office managers and those running the practices. I mean, not only did it obviously impact the patients, and the consumers and the individuals who either lost their jobs or kind of businesses went under, or were kind of told to stop and kind of stop their businesses for the time being. You had a lot of dental practitioners, right? You had a lot of dental offices that were not practicing for months, right, due to certain state mandates and so forth. So, I really feel for them as well, because they were getting hit, as hard. Their practices were literally, told to stop and not practice at this point. So I commend them for how they managed to handle, the communications that we saw with their patients, and the understanding and the empathy they had during these challenging times, but as well to their team, to keep the morale up and to keep things moving internally in the practice, and to make sure that they didn't miss a beat. So when that door could open up, they were well poised to succeed. But again, as Jake alluded to earlier when he touched on the pandemic, the preparedness is massive, and that's for any business, whether you are a 2-person a dental office, 2-practitioner dental office, or a 10 practitioner dental organization. Having the mindset of things can happen, things may happen, and having that preparedness is really important. And what that communication looks like out to your patient is huge with respect to how things get handled and how receptive they are, and knowing what the circumstances are, and just putting that plan in place and expecting and preparing for that need in that situation, to again be empathetic and to be understanding and sort of walk a step or two in their shoes to know that this is what's happening and how do we plan for it to get the best result for all involved, to keep our practice lights on and also keep the patient happy, but still keep that, again, at the end of the day, keep that cash coming in and how do we communicate that and plan for that successfully. So I think it was a challenging time for both, and I think what it did for the practitioner in that situation was he or she were able to walk a few steps as well as the office manager in that patient's shoes, because they too got hit, right? They too had to shut down and stop. So I think it was an interesting time. But what we've seen is they've been empathetic and understanding, and are trying to look for the plan, right? For the plan of success. They want to keep those patients happy. I don't know, Jay, if you have anything else to add to that, but that's sort of what I've sensed and what I've heard from our clients who are dental offices.
Yeah, the one thing too that I'll add is, what's interesting that you mentioned is, the practice is having to shut down because of state mandates. So if there was a practice that had to shut down and work from home via state mandates, or they had a couple people in for emergency procedures and things of that nature, what we were really able to do for those clients is be that person who's still making those phone calls and making those communications to their patients while they were not able to. So we were that lifeline between the practice and the patient that owed the money to be able to answer any questions that they had, to be able to be there to support them, and to be able to get them again back on track in that empathetic way, or just be able to talk through the situation with them. Because that's really what we do best with our strategy that people first approach. We understand that going into that conversation with a patient, that we might not get that issue resolved on that. They might have questions, we might have to go back and forth. So we're very much there to be an outlet for that patient in relation to that debt, and to be able to help get them from where they are now to where, to that successful repayment, whatever that looks like. If it's splitting up the payment, working on some sort of hardship arrangement, various different things within that.
Yeah, it's a great point, guys. Again, yeah.
Sorry, John, if I can. Jake brought up a great point. I didn't think on it, because my mind is not in that space right now. It's more about kind of providing a good takeaway and some practices internally for them. But when that pandemic hit, as Jake said, we were able to kind of really move and pivot and address the needs of the clients, like Jake just said. That's something they need to be mindful of too, right? Is what is that organization you're relying on to do that? How well poised are they? And what's their internal operation look like? And can they, like Jake said, pivot on a dime? And when something is as catastrophic as a pandemic hits, are they going to be able to keep that communication going in a really good, streamlined way, and keep that cash flow, keep that opportunity rolling into the practice? So that's a great point, Jake. And I just wanted to further touch on that whether it's us or somebody else, or whatever vendor might look like, that's important to do that due diligence on them to make sure they're well poised to succeed for you no matter what.
Yeah, and I'll tell you what, guys. I think that's just a really good way to close. I think, like we've learned, it's one of the reasons why I really enjoyed this featured company live cast here, because I think what a lot of the office managers are seeing is that, and I've been saying this for a while, the relationship gap between companies that provide products and services like you to dental practices, and then dental practices themselves. Everybody's been thrown into this big giant bucket where everybody's got to help out each other. Ultimately doing a lot of these things downstream helps the patient, which is, why we all love this profession. So I think it's cool that you guys are able to share a little bit about that and how you've been able to pivot and make those things work. So Alistair, as we kind of bring this home, love to have you share with everybody where they can learn more about CCM, and then also maybe what is the process, right? Once they learn more about you guys, how do you go about that initial conversation with the dental practice and them learning about how you guys work together with them?
Absolutely. Yeah, I appreciate the opportunity. So certainly you can reach us and connect with us, via our website, capitalcollect.com. You can certainly reach out to, Jake or myself. My email is acanal@capitalcollect.com. And, our approach really is consultative, right? We want to get to know you first and see what sort of practices you have going on internally, meaning your practices of accounts receivable and how you handle that. But we really like to take a consultative approach, do a little bit of a deep dive into what you're doing now, how successful it is, where the pain points are, and then we look to see how we can help you. And quite candidly, our philosophy truly is, people over profits, relationships over revenue, and trying to give back and help. So if there's not a real, need for our services, we're not gonna say that there is. But if we can provide some value in that consultative approach, that's what we'd like to do. And more often than not, it works out, and we build really strong relationships with our clients. So we consider it a privilege to serve this industry for everything they do. So we're truly blessed by that.
Awesome, guys. Well, listen, I know the ADOM team went ahead and put some links in the comments thread so they can learn more about you guys, get in touch with you. Thanks again. Thanks again for making the time investment, to come on here and share with everybody what you do and, more importantly, how you're helping them. So we hope to see you more. As we say to everybody on here, we're hoping in 2021 that there is meetings in person again where people can actually, shake the hand or fist bump with another human. We can get back to that world. And I know the ADOM team is very excited and honored that you guys came on today. So thank you so much for your time, and hopefully we'll talk to you soon.
Thank you.
Thank you. Take care.
All right. Thanks, guys.